Claire. I think it's okay to start.
Yeah. Okay. Lovely. Thanks, Emma. So welcome everyone. It's really nice to see so many of you here. I'm Sarah Mears. I'm the Programme Director for Libraries Connected. I'm here with Emma Daniel, who's my colleague at Libraries Connected, who's doing all the technical stuff and sort of supporting us admirably and sorting out all of our issues. So thanks, Emma. I'm also here with colleagues from NHS England who are working on the library app project. I was just going to give a very brief introduction and then hand over to them. But just before I do, if you could keep your mics off whilst the presenters are talking, but do feel free to, and please do put questions in the chat and we'll try and answer as many as we can. We've left about 15 minutes at the end of the webinar to answer any questions you've got. And we've got a really exciting webinar actually for you here this afternoon. I think it was just a little bit earlier than this time last year. So that was September, I think. We'd invited anyone interested to come along to a meeting to find out about being part of the NHS app project. And we were expecting probably about 8 or 9 library services. And in the end, we got, I think it was something like 63 who came along and joined in. So the project kind of took a slightly different turn from the one we were expecting. But we were really pleased that so many people were really keen to be part of the project. We know there are all sorts of challenges in libraries, and so it's even more special that so many people were willing to give it a go and try out the using the app in libraries and supporting customers to use the app despite those challenges. So today we're going to be really looking at the evaluation of that phase of the app and also thinking about opportunities for phase 2 and certainly answering any questions that you might have, or if we can't answer them, we'll take them away and find out the answers. And so I'm really delighted to be joined both by NHS colleagues, but also colleagues from library services who took part in the phase 1, and I'm sure some of you will be in that phase 1 as well, to share their experiences. And we wanted a kind of warts and all sharing of experiences because we really want to learn from that as we move towards phase 2. So I'm going to hand over to Ruth Carlisle, who will take us through the rest of the webinar.
Lovely, thank you so much. And thank you to Emma, who I know is about to share slides in terms of making all the wonderful technology things happen. So what we wanted to make sure that we were covering in terms of the session itself, and if we can move on to the second slide, is elements in terms of the learning from the first wave of activity, as Sarah's already indicated. Jo Foster Murdoch is then going to share her experience in terms of Norfolk Public Libraries. Marta is going to share a slightly different experience in terms of being an NHS app ambassador and how that complements through, but again with experience of working in public libraries. And then our thoughts in relation to the second wave through. So this is our outline. So if we move on to the next slide. So in terms of what it is that we're aiming to do. So if we think about what we did last time, and thank you to those of you who were involved in the first wave, but also to everybody who's just expressing interest in potentially being involved in terms of the second time through. What we really want to do is enhance the role, the knowledge of the role of public libraries in terms of the health activity, so that actually there's much more public awareness in terms of the fantastic work that public libraries are already doing in health and how this complements in terms of the existing work, whether that's part of the health offer in a formal way or whether that's broader work in terms of digital skills and digital literacy in terms of activity. So we want to increase awareness in terms of public libraries and what it is that you're already doing, but also how it is that it ties in with this work. We want to support you and your staff, whether that's paid members of staff or volunteers, to increase your confidence in terms of signposting to high quality information. And well, I'll come on to this in a moment in terms of that's one of the things that we found was important last time around. We want to make sure that in terms of confidence, we also have your confidence in terms of signposting and using, or potentially just signposting, depending on how you model it, the NHS app, the NHS website, those sorts of tools and resources. And then the fourth point is something which is slightly different from the points that we had in the first wave, because one of our learnings was that actually you did want to be put in contact with local NHS organisations. And so the fourth point is actually to do with enabling local partnerships, helping you to set up relationships with local NHS organisations, to work with NHS volunteers and to help people through that sort of partnership in terms of working with the NHS app. So those are the things that we want to share with you. And very excitingly, we have explicitly our own little paragraph at the top of page 53 of the 10-year health plan in terms of this activity. So it's something that the NHS is committed to over the course of the next 10 years. So we can move on to the next slide. So in terms of our findings from the first wave, we did find that actually, in terms of signposting to high quality health information, we did help people to increase their confidence. So if you look at the survey results right at the beginning and then survey results at the end, actually we did have an increase from 47.3 to 57.7 people being confident. So that was fantastic. So we want to build on that confidence in terms of skills for you, for staff and volunteers in your services. We found that actually we did have case studies that showed benefits to individuals. So particularly it was things like people who would otherwise not be able to do necessarily very much for themselves, able to at least do things like repeat prescriptions. So some really heartwarming stories about individuals in terms of case studies. We found that actually collaborations with NHS volunteers, where NHS volunteers such as the NHS Angels in Staffordshire, for example, where they were involved in the projects, actually that reduced pressure on our public libraries. So how it is we might be able to work more in terms of NHS volunteers in different roles. We found that actually public libraries found it quite hard to set up local relationships, and that's partly how we've changed how we're operating this time around. And Michelle will be talking a bit later on about how it is that we're going to be changing that process through in terms of supporting partnership development. We also found data collection was challenging, and I'll come back to that once we've had sessions in relation to other people's experience about how we're changing that. And we found that actually there's something to do with the value of national as well as local communications. And Joe McKibben will be talking about elements in terms of communications, tools, resources as we come through as part of this element. And that also for many services, there's that whole thing about funding and whether there are funding opportunities or not. And that we'll come back to that again. And I see Ian Moore has joined us on the call and he will be joining us for part of that session as well. So lots of different learning through, but also lots of excitement, including excitement from our Secretary of State for Health, that actually this is something that we can evolve, we can develop in terms of how it is that we work across. So I'm now going to hand over to Jo Foster Murdoch to talk about her experience of Norfolk Library and Information Service being involved.
Hello, thanks, and thanks for inviting me, Ruth, along to this today. So I'm quite happy to share my experiences, warts and all it will be as well. So yeah, but our journey in Norfolk, just that first slide there that gives my information if you've got any other questions or you think of something afterwards. Our journey with health, I suppose, started with our universal health offers and things with Libraries Connected way back in 2013. And then 2018, that changed again. In that time, we made a partnership in Norfolk Libraries with public health as well. So, there's been a lot of kind of background work gone on really. But before we even started this, and in 2019, we were lucky enough to get some funding. So, and that is the thing I think that's really key for libraries to be able to participate. There was some digital accelerator funding that we were able to access. And then since then, we obviously had COVID and that kind of thing, but we were actually helping people with the NHS website and things from 2019 onwards. And then even during COVID, we're offering support online, which seems almost impossible. We didn't even know what Zoom was, did we, in 2020? We were just learning then, but we managed to use those tools and did help a few people then. But so we're really pleased to take part in this because it kind of reinvigorated us in Norfolk, really, I'd say, because there was kind of the national thing that you were talking about, Ruth, and people coming to us saying, "Oh, wouldn't that be really good if Norfolk Libraries were able to help support the NHS app?" And we're like, "Hello, we are," but it's very difficult, like I say, for us to promote that and do that kind of thing. So, we did a couple of pop-up sessions at GP surgeries where. If you don't mind moving on to the next slide, please, Emma, if that's okay. We had some pull-up banners made, and oh, sorry, it's the one after that. Maybe I did this in the wrong order, but that's it. That's the lovely Jared. So that and in a GP surgery. So we had these lovely banners made, and it kind of gave a lot of information for our pop-ups. The banners were up beforehand when we did go into the GP surgeries. so that people were kind of getting used to them. And then we were there on the day with tablets and things to be able to help and support. We also had some bookmarks made that replicate that almost exactly with all of that information on. And we've now put some digital assets out to GP surgeries and things as well. So it has been a long journey of getting all of these things going and up and running. And we have had some lessons learned going into GP surgeries as well, such as the one we did recently. The GP surgery said, "Can you come along this time? We've asked people to download the app before they even get to the surgery," and the email that they sent out to every single one of their patients that they had an email address for, just reminded them a few days before, again, if you want to come along to this, if you're not, very confident with the NHS app, that kind of thing. So we had so many more participants this time around. We did 3 sessions just a couple of weeks ago, actually. And at each of those sessions, we saw 40 plus people in a 2-hour slot between 12 and 2. And that's the most we've ever done. And that's more because the GP surgeries themselves were saying, this is our session, this is your opportunity to come along. So I'd like to take the credit for it, but it's actually lessons learned from the GP surgeries themselves. That they were like, well, actually, we know last time we did this, it was taking ages just to get the app onto the devices, whereas most people did have the apps on their device. We did still help some people. And we did have to give some of our bookmarks away during those sessions as well, because 40 people in 2 hours was quite a lot of things to do. So what we had to do was give away some of our bookmarks and say, come along and have a one-to-one appointment at the library. And a lot of people weren't library members or anything like that. So they were like, oh, I can do this at the library, and you don't actually work here at the GP surgery. So there's things like that. That we've been doing. But the national campaign, as I say, that really did help. The kind of reinvigoration of everything was really wonderful and helpful. So I think that'll help again in the future. Yeah, so just trying to think what else I've put down there. Branch managers are really the connection between us and GP surgeries, that has been the tricky thing. So I really, will embrace, what if we can move forward with that. But our branch managers, a lot of them do have a relationship already with the GP surgeries. Some of them haven't come quite along far enough to get, have the NHS app. Some have no services on the NHS app, only just repeat prescriptions. So each GP surgery we went into had different services as well. So it's when you have those relationships with them, it's helpful to know kind of where they are within their journey with the NHS app at each different surgery. And although the 3 surgeries we went to were part of a network, each one was at a different stage of their NHS app journey, which was interesting. So that's kind of it where we are at the moment. So we're still going on with it. We're still, it's health digital get online week and health information week and all of these things. We're making sure all our libraries always have this kind of information all the time, really. But branch staff are feeling more confident now as well. We delivered health information training way back in. They probably need another refresher, actually. The refresher is just something they can dip into themselves online. And we also have something called MEC training as well, which is Make Every Contact Count training. So when people go into our libraries, staff feel confident to know about signposting and that kind of thing as well. So it's kind of part of the whole package as well. And each branch library is different, depending on how, if they have enough staff to deliver any one-to-one sessions, or sometimes it'll be volunteers, sometimes they'll do drop-ins, and they'll go along to pop-ups and things as well. And often I'll go along to pop-ups as well. Another really good thing we went to was a pop-up event. Sorry, am I going over my time? I just had to talk about this one other event that we went to, which if you can get onto something like that, was really helpful. And that they had a massive musculoskeletal day at the showground in Norfolk, where we saw over 800 people came through the doors that day, to be able to have to go along. They've been on the waiting list for quite a while for musculoskeletal conditions, so they had kind of things on their mind. And then when they came out, they wandered around different stalls and things. So people like who else was there? Age UK and ourselves were there, and we made so many new sort of contacts and different people, and gave out some more of our little bookmarks and things. So we had some really good conversations there. So, Emma, do you want to, sorry, just go back to the other slide again, please, if you don't mind? If you can, go backwards, but don't worry if you can't. So, yeah, this is kind of like our digital asset there that we'll be using online, which is the same as all the things that you know, like our bookmarks and things. And this will be on the screens of some of the GP surgeries, but also on our self-service machines in our own libraries as well. So, but I'm happy to take questions when the time is right, but I hope I haven't taken up too much time.
Brilliant. Thank you, Joan. So I'll pass on to Marta.
Hi, good afternoon, everyone. Joe, thank you very much for your presentation, and I really enjoyed the name Healthy Libraries. That's really sounds good. Yeah, good afternoon, and I just wanted to talk about my experience working with libraries. My name is Marta Fisher, and I work for Buckinghamshire, Oxfordshire, and Berkshire West Integrated Care Board, NHS Ambassador for 2 years, and also digital transformation manager. So I have a little bit of also overview from NHS, but working with libraries, not as a librarian or from the local government side. And we started to work with our libraries probably about 18 months or so ago. We had a pilot starting in Buckinghamshire with 5 libraries, and that went really well, and it increased number of people coming to libraries, and also like interest basically in digital literacy. So we started to work with libraries in other geographical areas as well, and currently we cooperate with over 20 libraries on everyday basis. And so basically we mentioned a 10-year plan, which obviously from NHS point of view, it's the most important aim to increase NHS app usage, and NHS app become that front door. But also we need to think about digital inclusion in general, which, as you know, probably has been set by the new government this year to increase usage of all digital services and make all organizations responsible basically for participating in the general inclusion program, and involve local communities and partners to work together towards increasing digital literacy. So libraries naturally have people trained with digital literacy and helping out for a while already with some basic digital skills. So basically slightly making this more wider service for NHS app is just basically part of it. And I'm sure all librarians already know some basic digital skills, such as how to download the app or use the app. And NHS app, maybe there is a little bit of anxiety that this is something different or more advanced, but we have to look at it as any other app you download, like Facebook app or WhatsApp app, and registration is very similar. You need to give your email and follow the steps to register. And yeah, just help local communities, what we do as well, and that will increase your footfall and engagement from community, support local community. And we found out from different feedback and reviews that what people reporting to us is increasing well-being as well. So they're very grateful for learning that learning of the new skill make them more confident in general, and increasing that well-being in general, as they expect that some services remain face-to-face, that gives them that confidence that there is a point of contact for them for NHS app as well. And this point of contact is a safe space in the library when they can trust people who support them. So that's fantastic. And upskills library staff as well, because as we say, it's a part of the general digital inclusion, and that digital literacy, health literacy is part of general literacy, digital literacy. So upskilling for that it gives the staff great benefit. And what we do, in generally speaking, in the community, we empower them to use the skills, use the services, and when they learn these basic skills, they can translate them into other services as well, which is very important. And can I have the next slide, please? So here you can have a look at the statement from our librarian, who is also leading manager for regional libraries, 6 libraries, and quite often we get that feedback from them, that it's great to see more people coming and using services, increasing interest in libraries as well, not only for coming and reading or hiring the book, but finding library as a point of contact for other services, which is great to hear and see, and great to receive this feedback. Thank you. Next slide, please. And here you can see some outcomes directly. We gathered some feedback from patients, and what they often see is like they see that in every library. So we've got some patients coming and traveling actually quite a long distance to get to the library, which actually provides that service. We even had to complain from a few places that the bus, which is going somewhere, doesn't necessarily take them to the library, which provides NHS services. So you see that we have great journey, and we had some great feedback from patients who learn started with very basic digital skills, came to learn something like, I want to contact my family and know how to send pictures to my daughter or grandchildren to Canada, but they found it really, not challenging at first, but then great skill to learn, and we're coming back and learn more and more, and to either have great new skills, access NHS services, but also sometimes even get a new job or completely change life or career through this. So yeah, I think the librarian already had skills, and it would be great if we could continue and widen the services across UK, so we can provide more and more people with that confidence, well-being and support. Thank you.
Thank you, Marta. So if we can move on to the next slide. So apologies, I should have introduced myself earlier on. So I'm Ruth Carlisle. So I'm one of 2 heads of knowledge and library services for the NHS in England. So I'm responsible for the quality of the services and the professional development of the staff. And we had hoped that my colleague Jo Stead would be able to present with us in terms of some of these areas through. Jo is actually unfortunately not well today, but she's one of the policy people. So policy into action is part of what this activity is through. So in terms of changes from the first wave, I alluded earlier to the fact that there are actually quite a few different elements where we've had learning from the first stage and changing through. So engagement was difficult. So we are going to be working much more in terms of support with setting up local relationships. So Michelle is going to be talking about those shortly. We had various library services that were talking about confidentiality, and they said that actually services varied in terms of how it is that you might operate, in terms of how you might have the spaces in which you operate, and you wanted to have some general guidance that you could adapt. So we will be providing general guidance on confidentiality when you're working with the NHS app. Data capture was actually just too onerous for some knowledge and libraries, so some of your local services in terms of public libraries. So We will provide tools for those who wish to do it, but we won't actually make it something that we ask in terms of the quantitative data. What we'll do is look much more in terms of using the knowledge exchanges in terms of gathering stories. But if you do want to have unique URLs, we think we've got a way of doing that better in terms of being able to gather the data, because that didn't really quite work last time through. We've already mentioned NHS volunteers are helpful, so as part of creating local relationships, we'll set that up, or we'll work with you to identify where there are people to set those relationships up. We still don't have dedicated national funding, but as Ian will refer to later on, we may have opportunities in terms of local funding, and this is the start of a 10-year element. Who knows, there may be money somewhere along the course of the next 10 years. We will, because of the refresher test requests for training, make sure that we let people know when it is that we have our online training updated, and we'll also have drop-in sessions that are available and provide national as well as local communications. So those are the changes in response to feedback. So we'll move on to the next slide. In terms of our timeline, so starting recruitment as of now in terms of getting people involved. And if you're interested today, we'll take questions now, but we'll also have a much less formal drop-in session on the 4th of November if people are interested in terms of asking questions then. So starting recruitment in October, having sessions in November and December in terms of getting people to engage with and learn more about the processes, learning more about the NHS app itself in terms of drop-in sessions and using the different tools that are available. Starting to promote to the public in Health Information Week. So that's should be the 9th to the 25th of January. So my apologies for the typo. I thought I'd edited that on the screen, but obviously hadn't. And then we've also then got a wider public campaign on an ongoing basis following that. So lots of different activities through. So the next slide. So in terms of our asks of public libraries, so trying to keep it fairly simple. So it's actually assess how it is that you want to do it. So whether it's booked sessions, monthly events, or signposting, however it is that you might want to do it, but work out what it is that you want to do. And then the second point is, however it is that you do it, make sure that staff, both paid and voluntary, are aware what it is that you're doing. So that you've got that point through. That people should actually use the online toolkit to download templates for, in terms of communications tools. And one of the things in terms of feedback from last time is we will have more resources that you can adapt yourself in terms of activity through. To use the online toolkit in terms of signposting to health information, so that includes things like your health collection, but also we've got an update to the Patient Information Forum website, and thank you to the services that are involved in terms of the workshops to inform that update. And then just the last of the asks, and it's just because they're spread over 2 screens on the next screen. Sorry, thank you. So it's basically to make sure that staff are familiar with the short videos and the online toolkit in terms of resources, that liaise with us in terms of setting up collaborations, if that's helpful to you, taking part in knowledge exchanges to share stories, and knowing how to ask for help. So whether that's going to the NHS app help and support desk, or whether that's coming with general queries in terms of the Knowledge for Healthcare england.kfh@nhs.net email address. And my colleague Michelle is putting some links into the chat as well to help you with that. So I'm now going to pass over to Jo McKibben in terms of learning resources.
Hello, everybody. So here's just a quick walk through some of the online learning materials that are available for you online. During the wave 1 of our partnership, we co-created a lot of these learning resources, and they show you how to set somebody up with an NHS account. So rather than downloading the app, people can still access their NHS account using a browser on a computer library, a library in a computer as opposed to a browser on a mobile phone. So there's information there about how to set up the account. There are walkthrough videos. There's also a longer form video introduction to the NHS app and NHS account, which is about 20 minutes long, and it's really there for somebody who knows nothing about it and can go, okay, I'll spend 20 minutes watching this video, it might be quite helpful. And there's also what we've also learned over the past year is that real need for step-by-step guides, and also to broaden out the partnership into the community. So librarians and libraries, you have your dedicated web page, but we've also created a web page which is a sort of community support, you know, how you can help in your community, which is sort of broader than the librarians page. So all of the links here are in the chat here, and it should, you know, it's all pretty self-explanatory if you follow those links. So if we pop along to the next slide, please. Now, the volunteering portal has recently launched in the NHS, and what it is, it's a single sort of national point of search for people who want to volunteer in the NHS in England, and they can use their postcode to search for local opportunities. This was very much set up post-pandemic when lots of people put themselves forward to volunteer to help the NHS. And so there's a huge bank of people who really want to help the NHS. And so this portal was launched very recently, and basically it's free to use, there's no charge, it's digitally accessible, and it's easy to use, and it basically supports location, availability of people, and the skill set. And it's open to NHS organisations in the voluntary care sector, but it's also open to libraries. And so essentially it works like almost like a message board where you can advertise. So you can say, oh, I'm in North Somerset and we've got a digital inclusion session and we're looking for tech savvy people that would like to volunteer and help at this digital inclusion session. And you can pop all of your details on that, and then that connects you with people who may be looking in that area and say, oh, here's my postcode. Oh, I quite like doing that. I'll contact the library. So it's quick and easy to use, and you can promote your volunteering opportunities to sort of wider and more diverse audiences. And there's no formal requirement for you to prove your partnership with the NHS. It's run by the NHS Business Services Authority, and they do the onboarding. And they know that libraries will be contacting them or applying to join the forum. So what you need to do is email this email address, complete the form, and then follow the steps with the volunteering scheme. And it's just a really good portal for you to advertise for volunteers. And if we quickly pop on to the next slide, please. Comms materials. So this is the link here to all of the toolkit general promotional materials. It's printable, it's available in black and white, there's posters. Now, what I would like to say is that we are updating those materials so that there will be a poster that you can customize, which is what Ruth mentioned earlier. There are screensavers, there's images for your local Facebook page if you have a local Facebook page, and text copy that you can use to promote sessions. We're also reworking the walkthrough videos, because there are, and this will happen in January, there is a new look and feel to the app. So it's the navigation that has changed. It's not the services or the features. It has been tested with users. It's easier to use, it's more intuitive, but it will look different. So we are updating those materials, and they'll go live in January. So just be aware. And I think that is all for me for now, and happy to answer any questions in the chat. Can move on to the next slide. Thank you.
And actually, just to cover that one quickly through. So this is the Patient Information Forum directory. So thank you to colleagues who were involved in terms of the workshops to look at how it is they might improve the signposting to what's already been pre-accredited in terms of content, and adding the search feature through. So we now move on to Michelle, who's going to talk about support to you.
Thank you, Ruth. So yeah, I'm Michelle Hume. I work with the digital partnering team at NHS England. And the first thing to tell you about is regards the ongoing support that we're providing to libraries as part of the NHS app campaign. We'll be holding regular sessions for libraries that are involved in supporting the public with the app and the NHS account. So there's two different sorts of online meetings. The knowledge exchanges will be up to an hour. They're informal and they're designed to provide a supportive space for library staff to hear about any national updates that we have for you, find out what's working well in other libraries and also what isn't working well. Case studies, so that we can work with you to pull together some new case studies. We'll be keen to hear about the sort of library link-ups that you're having with local NHS and local public health teams, and we've heard some examples of that already. These are sorts of things that bring people into the library and for health screening or whatever it might be. And whilst they're there, then, you know, perhaps you can be speaking to them about getting them online with the NHS app, or making an appointment with them to come back another time to do that. So that's the knowledge exchanges. And there's the drop-in sessions. These will be about 30 minutes long, during which time staff can drop in, ask questions about the app and the app functionality, raise any issues or challenges that they're coming across while they're supporting users, and the sort of typical questions that that are being asked in the libraries, you know, plus share feedback as well. You don't need to make any preparation to attend these calls, and you can come along, of course, even if you don't especially have anything you wanted to share, no specific issues to raise. But it's a great opportunity to hear from others, share experiences and stay connected with the whole initiative. Next slide, please. So these are the dates for those two different sorts of meetings. The first knowledge exchange, you'll see there, 4th of November. That will really just be an extension of this meeting, if you like, to follow up with any further questions that you might have or that we don't get sufficient time today to go into enough detail on. And the invite, we're expecting that to go out tomorrow for that one. So please look out for emails from, it'll be the Knowledge for Healthcare email address, which is england.kfh@nhs.uk. Next slide, please. Okay, so the helping libraries to work with NHS partners, obviously that's key to making this work. That's what we heard loud and clear from the Wave 1 participating libraries. So my team, in digital partnering team, will be leveraging the links we have with colleagues in the NHS regions, but also in integrated care boards, to ensure that they are proactively supporting this partnership work. They might need to be going out to practices too. I think Jo Foster-Murdoch was saying earlier that not all GPs, surgery staff are confident with the NHS app. So that's something we'll be pointing the ICBs to help with, as well as obviously helping library staff too. So we're hoping that from that work we'll get some much better buy-in from colleagues in primary care. That'll be GPs, community pharmacists as well, public health teams, to work with our library colleagues. And we'll be liaising with your local ICBs to provide named points of contact to support you with perhaps technical issues you might have, but also using their communication channels to communicate what you're doing locally in your libraries and make sure that's known about in the GP and the pharmacy outlets. So there's an email address there that you can use in the first instance, and that will then get forwarded on to the team at NHS England for action, and I can post the link to that in the chat shortly. Next slide, please. Okay, so getting involved. Some of you may already have responded to the invitation to get involved, and thank you to those of you that have. You'll be hearing from us very soon if you haven't already. For others, please take a look at the link where you'll see information about this second wave of activity, what support is available, and you'll find there's a form to complete to indicate your level of interest to participate as well. So yeah, the link for that will be going in the chat in a sec. But I think one more slide. Thank you. And of course, we do know that lots of people, this is new to lots of people, a new area of work. And so we think it would be really helpful if you could complete this very short confidence survey and ask your frontline teams to complete it as well at the start of this piece of work. So before they've actually used the training materials and naturally gained confidence and knowledge from doing so. So, you know, now really, before that's happened, it would be great if they could complete this short questionnaire. We'll then be asking the same questions in a few months' time just to see how the library staff are feeling at that point. So this survey is accessible either via the web page link there or the QR code. We all love a QR code, don't we? So thank you very much. I think I've probably gained us back a couple of minutes there. So thank you.
That's lovely, thank you. And we're going to pass to give Ian an opportunity if there's anything else that Ian Moore wanted to add from your perspective in terms of reflections on funding.
Hi, is that working? Brilliant. Yeah, so I mean, this is all absolutely brilliant. It does bring up a couple of quite a bit of attention for us, because when we're talking to central government about new things that libraries can deliver, we tend to have a fairly stark message of no pay, no play. If there's no funding, then we as an organisation can't expect libraries to do some things, but we do know that a lot of libraries will do things because it's about developing the services for their members as well. So what we're trying to look at is 3 different ways to get funding in. Central government funding, and given it's the NHS 10-year plan, we are identified in it, and what we can do where central government identifies an additional burden on local authorities or an additional expectation of local authorities to provide something, there is new burdens funding that can be identified and given out by central government as well. So we're working with our new policy director on navigating that and trying to work out if we can get that new burdens funding unlocked and bring some funding in to do that. The second bit is looking at regional and local funding through the ICBs, and as Michelle and Ruth were mentioning, they've now got this link into their digital partnerships team within the NHS, and that unlocks a way to essentially put the libraries or groups of libraries in touch directly with the ICBs. And the ICBs are responsible for then all of the delivery of health services within that area, including the NHS trusts and the GPs surgeries as well. So there's a potential for the ICBs to then be able to unlock funding as well. What we would like to do with that as well is then also provide the libraries with a bit of collateral to then go to the ICBs to say, we're delivering this service, we are achieving 50,000 additional signups to the app every month through this one library service. And so we'd then like to be essentially kind of compensated for that, to be able to continue to deliver that as well. The other link that we can manage through that digital partnerships team is links not to funding, but to other organisations who've got NHS app ambassadors in the region as well. So there could be resources provided in kind there as well, which might support that delivery. And then the final bit, there are some smaller pots of funding as well. So there are some evaluation funds for maybe 1 or 2 of the library services that might be able to get some additional funding in there as well. So we've kind of got those 3 strands looking at that central government funding. How can we get the new burdens funding to release funds from central government to then ensure this aspect of the 10-year plan's delivered? Looking at that kind of local funding, connecting to ICBs, but then also looking at what small pots there are available. We're still trying to work out the best structures for that connecting to the ICBs. There's some of the bits that Michelle's highlighted there as well, and we're trying to work out how we can make sure those connections around funding as well.
Thanks, Ian. Thanks for that, and really helpful to kind of identify all those potential possibilities for us. So we have got some questions, and they are being answered as we go through. But it might be worth just spending a little bit of time clarifying some of them. And also, if you've got any other questions, do stick them in the chat, and I'll scroll up and down to find them. So I think one of the critical ones, and Ruth has answered it, but is one that says, do you find library staff are asked by users to navigate the app for them, explain results, read out GP comments, etc.? Ruth, did you just want to kind of give a bit more detail about that?
Hang on, just add pin. No, there we go. I'm spotlighted already. I think that was Emma. Thank you. So in terms of the expectations, this is not about making public library staff into health professionals. This is about public library staff doing what public library staff do best, which is about signposting high quality resources in a trusted space, enabling people to be able to access things they wouldn't otherwise be able to access. And that includes understanding how it is that you might be able to access things, but it's not interpretation. It's not about looking at different screens through, and a lot of it's general guidance that I'm sure you would do anyway. It's like don't put your details of your diagnosis into ChatGPT to get it to diagnose you, because it's not how it works. It's actually about making sure that people understand that information needs to be understood by the relevant professional. So it's not asking you to go above and beyond or to change that. It's actually about giving you some tools to be able to do what you already do fantastically well.
I think, sorry, to add to that, Ruth, I think Marta's probably got some quite anecdotal examples of that. You may not, but as you're, usually, and Joe Foster Murdoch as well. But sorry, over to Marta.
Thank you, Joe. I was just about to press my hand up, actually. That's right. I think what we need to remember as ambassadors or librarians or anyone who just helped out is that there are two parts into support, I would say, with NHS app. So first step is download the app and register. And the second part, start using the functionalities, etc. And now with most of the work people the supporters do is actually just downloading and registering people. And this is where you have actually full power and control over what you're doing. Once this is set up, once the app is actually up and running, so you register, and anything beyond that, so any errors, problem, you have, information, can't use the service, please contact your GP, etc. So this is where this comes out of your power. So just please remember that you won't be able to help with everything. And there will be errors or problems where you need to reach out, and you need to establish that point of contact on your site. And that would be either maybe someone in GP service or in your area, or someone in ICB. But it's worth to have that handy. Who do I contact when I have these problems? And the same, we've got, of course, NHS app service, which is contactable. And when you register, the links work fantastically and they respond within the time. But that time is usually 24 hours. So it might kind of make people a little bit frustrated that, well, I'm already here and I want to finish it up, but unfortunately, even registering or how to using this function is more complicated than we can imagine. So registering is, fairly something in our control, but beyond that, any functionalities, and I saw in chat some comments about, we weren't aware that GPs are actually not enabling the services. So, so people get a little bit frustrated when they're like, I just wanted to have it to do my appointments, but actually I can't. So please ensure them that NHS app is enabling all of these functions, and whatever is not working, they need to contact the GP, and if they enable that service for them, that's not in your control. It's not NHS app fault or NHS app team. It will be in control of your GP practice, so it's worth it to establish that connection with ICB or GP to have these questions run past them. And if any of this functionality is disabled, that will also, it doesn't mean that GP doesn't want to use it. It's also different factors such as like digital maturity, what IT we have connected, and how connected our services, etc. So it is beyond your control. So as much as people get, sometimes it's really rarely that they get frustrated, but you might need to send them out to a GP or establish that contact with ICB, who would be helpful in the situations. But the registration process is really straightforward, and as I said in my presentation, for any librarian who feels like, oh, a little bit scared of like, this is more than I can do, maybe this is like downloading and using any other app, exactly same registration. Follow the process, give your personal data, NHS number, ID, etc., etc. You might find that some people, for example, find very difficult to kind of navigate, like, I need to confirm something with my email. Is the email on my device? So maybe start with, do you have email? Do you have access to your email from your device or your computer? Can we access it when we're doing it? That's like the first step, which really help you to move the registration quicker. And if you feel confident, you can just quickly help people to just open your email or something. But beyond that functionality, you can explain them about functionalities, but you might find that some surgeries will be limiting those for different reasons. And they need to come back to the surgery and find out why.
Thank you, Marta. And Annabelle's asking about free Wi-Fi and it's not secure. And Ian's kind of has put a suggestion in the chat about that. But Ruth, or colleagues from NHS, have you got any thoughts about that?
Sorry, did you say free Wi-Fi?
In library.
Yeah, I think we would expect all libraries to have Wi-Fi available at that point for everyone. It might be that, from my experience, you need to register, or you need to register in that library. So, but that's a very quick process. But quite often, if you're not registered as a library user for book borrowing, you can get a daily pass or password for guests.
Yeah. It's just the security of that that Annabelle's asking about. I don't know if
security.
Any
security for library, you mean, or for the users?
For the users.
Yeah, that's 100% secure. So when you use the app, basically, it does not. How the app operates, it does not bring any information from the clinical system down to your app or your device. So the security is ensured by this, that you have the password and login details, and only when you actually log into your app with those details you get connected, which means you have access to information. Once you log out, you don't have that access. So using Wi-Fi, even in public space, it does not enable anyone to get into that information.
Thank you. Yeah, brilliant. Thank you very much. And I'm just looking to see whether, because quite a lot of the questions have been answered. Ruth, I wonder whether you could just talk a little bit more about the kind of levels of engagement, because we are, I think, fairly flexible about the level at which you can engage with this project. So, for some library services who really want to, or have a, have a sort of an imperative to do an awful lot of support, that's fine. But if it's just a matter of signposting, we still want you to be involved. And I think that's, Ruth, do you want to just explain that and the different levels that came up last time?
So at this point in time, when there's so much misinformation, so much misunderstanding of which sources you go to, any level that you engage with is important and will make a difference for individuals. So trusted signposting to resources that people can trust, whether that's the NHS website, whether that's the NHS app, or whether that's the resources in terms of things that we put through in terms of patient information forum. That's fantastic in and of itself. So it may be that actually for some services, the signposting is what you do, and that you use that through your social media, through whether it's in terms of rotating messages that you have on your screens in the library, those sorts of things. And that's absolutely fine. That's one way you can do it. You can do something which is much more in terms of, should we say that the signposting plus, in terms of it may be that you're beginning to build relationships. This is a 10-year partnership. It doesn't have to be all at once. So it may be that you're beginning to explore what partnerships there may be at a local level alongside that signposting. So you can then see what the next stage might be once you have more in terms of relationships locally, in terms of what it is that GPs are doing, which functions are being switched on, which are not being switched on at this point in time. Your next level up from that would be much more to do with having local partnerships in terms of, it could be that you have bookable sessions. It could be that you do it so that you actually have somebody who comes in through the ICB, somebody who's an NHS ambassador, or it may be that you have members of the staff team or volunteers within the library service itself. But bookable sessions, say once a month or whatever it might be, or it may be that it's individual sessions that you book rather than having a full time through, depending on what it is that you have resource. And we're open to people's imagining of what the art of the possible is. I mean, what Joe was talking about, Joe Foster-Murdoch, we have lots of Joes, it's a really good name. Joe Foster-Murdoch was talking about elements in terms of how actually it's evolved the work that she's been doing over the past years. So it isn't the same now as it was in 2018 when she started talking about the description through. So there will be that sense of allowing for things to evolve as relationships, as funding opportunities, as different elements come through. So we are completely open to whatever people want to do. And if it's just signposting in a world of misinformation is phenomenal. Don't underestimate it.
Thank you, Ruth. Thank you very much. So it's exactly 4 o'clock. So I will be closing the webinar. I just want to say a huge thanks to all of the speakers. I won't go through all the names, but to all of the Joes and to the Ruths and to the Michelles and to the Ians. And also to Emma for kind of pulling all the slides together and sharing them all so smoothly. Thank you, Emma, for that. Just a big thank you to you, and thank you for all of your really interesting questions as well. They're really helpful to have the things that you're thinking about, but also thanks to our colleagues for all of those resources. There's so much resource on there that's really useful to have too. So any more questions, obviously do keep them coming either to us or to Ruth. We'll want to make sure that we feed those in as well. But just say a big thank you to you all, and particularly to all the speakers today.
Thank you.
Thank you.